This problem is 1.35. In this one, there are these medical instruments, and there are two designs, design A and design B, and these are used to get the baby out during the delivery if there are any complications. Okay, so this is where the baby's head is going to be, this right here and this right here. So if you think in terms of free body diagram, there are these forces given which are common to both of these designs. This force that is used to pull out, in the first case there is this clamping force which is given as 20 newtons, and if you consider this part right here, so if the baby head is there, so on the instrument there will be a force coming from the baby here, so let's call that FH by 2 because that's coming on the head of the baby, and it's going to be a force which is on the instrument from the baby head, and similarly in the opposite sense. Now there's a force that is coming on this instrument from the birth canal, so let's call this a force Fm over 2, which indicates that this is coming from the mother. So same thing is going to happen here and here. Now these are the pivot points here in both of these cases. So if I consider the free body diagram of only the top section there, on this pivot joint you are going to get two reactions, and one reaction in x direction, one reaction in the y direction. Similarly, if I consider only the top part here, there will be a reaction going this way here and reaction going that way. I am not naming them because we are going to take moment about these pivot points, so these forces will not come into picture at all. So if I do the movement balance here, from the movement balance for design A about the pivot point, we get FH minus FM divided by 2 at this point, and this is going to be giving you a clockwise movement with a distance of 150 mm there. Now this Ft over 2 is going to give you an anti-clockwise movement because we are going to consider the bottom part there, so minus Ft over 2, and the distance here is going to be 20 mm. Similarly, this 20 Newton force is also going to give you anti-clockwise movement, so minus 20, and this is sitting at a distance of 75 from here. So this has to be equals to 0. Similarly, in design B, if I go to this pivot point, the first term Fh minus Fm divided by 2, in this case the distance is 240 from here, so 240 is there, and the only force that will be there on the top part is this Ft over 2, and now in this case this is going to give you a clockwise movement, so this times 25 mm equals to 0. Now from these equations for case A, if I solve Fh minus Fm, this number here, if I substitute the value of Ft equals to 120 here, this comes out to be 26 newtons, and in the second case Fh minus Fm comes out to be only 0.5 newtons. So what does this mean? It means the force on the head of the baby, which is Fh, is in this case increased by 20 newtons, whereas in the second case the force coming from the canal is reduced by 0.5 newton. So of course what do we want in this situation is we want the force on the baby's head to be as less as possible. So from that perspective, your design B is having lesser force, so design B or the divergent lever design is better.